Hello, it's 2:55, a little bit early for the old Facebook Live, but I'm double booked this evening, so I'm going to do it now. So if you can't join me live, then I hope that you can see the replay of this. So I've got a few questions. I haven't got the facility to put them on the screen here because I'm on the old the traditional Facebook Live, but I have got the facility to do other things. Might press that button there, which I'm not sure what that does. Okay, that hasn't done anything. Okay, anyway, what does that do? Viewers. I haven't got any viewers. Okay. Anyway, we'll move on from the facilities. What's that? Speech bubble. Right, a comment. Okay, so there are several facilities here. Oh. Oh, there. Anyway, okay, let's get into this. What's first question is about bottoming out. What is bottoming out when it comes to BA, breast augmentation? Has the implant been placed or fitted? Thanks. So bottoming out is when the implant descends below the inframammary fold. So the inframammary fold is the fold where the bra sits. So it's the fold that the wire of the bra sits, and obviously it's the lowest part of the breast, at least the lowest part of the breast on the chest. You might have a ptotic breast where the breast is sort of droopy, but so the lowest part of the breast on the chest is the inframammary fold, and if the implant descends below that, then that's called bottoming out. So does it mean the implant's been badly placed or fitted? Well, that's one reason for it. It can happen if you over dissect the pocket, if you make the pocket too far low, too far south, if you if you have a lift with implants. I've only ever had one case, and that's with a lift with implants, where you're rearranging the shape of the breast and the implant bottomed out. But I think with any sort of complication like that, it's not necessarily, you can make the operation look fine at the end of the surgery, and then over time things can happen to make the implant descend lower than the fold. So and sometimes we need to deliberately lower the fold. That's where the sort of difficulty comes in, because often the footprint of the breast that you have is smaller than the footprint of the breast that we're going to create if we're creating a bigger breast. So we have to increase that footprint, so we have to actually lower the fold ourselves. And so it may not be that the too big, because it's a bad idea doing it in the middle of theatre, but it may be that, so whatever the cause is, that's what it is. It's the inframammary folds of it too. The implant's descended below the inframammary fold. Sorry, Barbara. Sorry. Oh, yeah. Okay. All right. I accept. I shouldn't have done it in the middle of theatre. But there you go. I don't know what's going on in Facebook. It'd be nice to see, because I keep on getting things saying poor network connection. God knows. I've got my three. This question is, what is it? It's please could you ask the doctor a question for this Q&A? I've been researching and reviewing your work, JJ, and I can't help but notice you create many very natural-looking breasts. Thank you. With implants, stroke, lift surgery. Would you also be happy to provide your patients with a more fake look if that's what they wanted? Is this something I've experienced in many thanks? Now I am going to go and look in. Can I do that? What happened there? So yeah, I do. Oh, it's breaking up. Oh, Amanda's saying she's got a terrible signal. Amanda, I think it's me. It's not you. The signal. I think it's my signal. I shouldn't have done it like this. I'm sorry about that. Anyway, I'm going to battle on. So yeah, I do try and create a fake look. That means more fullness in the upper part of the breast, a more rounded look. And that is really achieved with the profile of the implant. So that's more towards an extra high profile implant. But it also depends on the shape of the breast before they start. So if you've got quite a big breast, particularly if you've got a bit of a sag to your breast, it is actually quite hard to make it give that fake look, that rounded look, because the natural breast on top of the implant will sort of droop and soften the shape. So I would say I specialise in, and I'm probably not the guy when it comes to big round implants. It's not my forte. I would say I'm probably more involved in a more natural looking shape, restoring volume back into the breast that's lost volume, or a breast that's always been a bit small for the frame. So creating a breast that looks sort of overly big for the frame and almost too big for the frame is not really what I do, and I do try and stay within the base width of the breast. So patients who want a really big implant, especially 800 cc's, 1000 cc's, that's not really my forte, and there's probably other surgeons who are better at doing that than I am. But having said that, I will use extra high profile round implants. I will give a fuller look if that's what you want, as long as the width of the implant will match the width of your breast. Then I have used them, and that will give a fuller, more fake look. So it's something we really need to discuss. But yeah, it's something that can be achieved and is something that I do, but perhaps not my number one thing. Thigh lift, saggy skin around the knees, a new dilemma. Will it tighten with my thigh lift? Probably not. Probably will not tighten with your thigh lift. Probably remain. If you've got skin, I would have thought, for a separate incision, depending on what sort of thigh lift you have, because one thigh lift, the incision is right up in the groin, so that's not going to really do anything to the knee. The other thigh lift is an incision down the medial aspect of the thigh, which might do something to the knee, but it won't directly address the knee. So if there is an area specifically around the knee, that might have to be addressed separately with a separate incision. Fat freezing versus liposuction. Is there a difference in ice liposuction and just liposuction? Yes. So ice liposuction isn't liposuction. So fat freezing is, I think they call it liposculpturing, or I don't know what non-surgical. Well, it's not really. It's not liposuction because you're not sucking the fat. Liposuction is a surgical procedure where you stick a metal tube in and you actually suck the fat out, and you see it going into a bottle. The things like fat freezing is a non-surgical procedure, so it doesn't involve a hospital, it doesn't involve an anaesthetic, it just involves a device being applied to the skin that cools the skin and cools the fat to the extent that the fat will die, with the idea that the fat's more susceptible to the cold than the. It's completely different, really. A liposuction is a bigger deal because it's a surgical procedure, whereas fat freezing isn't a surgical procedure. So therefore there's a huge popularity in the non-surgical things like the fat freezing. Having said that, in my experience and what I've seen, I haven't got a huge experience with the fat freezing, to be honest with you, but I've seen the results quite subtle with the fat freezing. Obviously everybody would prefer to have a non-surgical route and would prefer not to have surgery. To be honest, I prefer not to do surgery if I could get the same result without doing it. But it's a less of a result, so less downside, but less of a result. So it's fat freezing is often something people might try if they've got a little bit of extra redundant areas of fat that they want to have treated. But if there is any significant areas, and if you want a more significant, long-lasting, robust result, then liposuction is a bit more invasive, but will give more obvious results. Actually, I'm going to skip the question because there's something here that Corinne could ask.
Could be secondary to if they have fractures, then it could have propagated up to the olfactory.
Okay, there you go. I just. So here we go. We've got a rhinoplasty. I'm jumping questions. Oh, I've got another one for you, Karam. A rhinoplasty 8 years ago. I lost my sense of smell. Do you know why this may have happened? Really. And the other thing I say, if something's happened 8 years ago and it's still a problem, it's probably going to be a long-term problem if it's been there for 8 years. I'm not entirely sure why it might have happened. I've just spoken to Karam here, so just to have damaged some of the nerves there. Hard to say. probably a little bit academic, really, because I'm not sure if there's much that could be done about it. But yeah, so sorry to hear that. Here we go. After facelift, how long will I need off work, and how long before I can wash my hair? Would you let them wash your hair straight away after facelift? It's ringing me. Sorry. I've had 5 pregnancies. I feel bad. I had 5 pregnancies and I'd like to do a lipo, but I'm 58 years old. Right, sorry. Sarah's ringing me. Kuram, have you got Sarah's number?
No,
Okay. But I'm 58 years old. Am I too old? No way. No way. 58 is not too old for liposuction. Absolutely fine. In fact, these days we don't go so much on age. We go more on fitness. So if you're fit and if you're what's this? If you're fit and you're able, then 58 is no way too young, too old. Similarly, if you are not fit and if you've got a lot of comorbidities and you've got medical problems, you may not be a candidate. So age in itself is not a problem for surgery, any sort of surgery really. We're moving away from the ageist policies, and it's more on a fitness thing, and because the people are healthier for older, and 58, blimey, that's really young, so that's absolutely fine to have surgery, liposuction or whatever. Right, crack on, I'm fighting on, you know. I don't know if any of this is getting out there, getting through the ether. Please could you touch on breastfeeding when implants are in situ? I've looked at several articles which mention possible problems which can be associated with position of entry of the implant and nerve involvement, which could result in less milk production. So I haven't heard of this. I haven't heard of breast implants affecting milk production. When you say position of entry and nerve involvement, so position of entry, have I got bright lights? Do I look like I'm in heaven? I feel like I look like I'm in heaven. Is that better? It's better. Sorry. All the lights behind me were bright. Huh? What, you got a better phone? Ooh! I'm just going to... Right, this is my phone. This is my new phone. Top of the range. That's a beauty. Oh my God, the camera's just turned on. That's a beauty. Yeah. One day, I'll get one of them. One day. Look at that. Look what I've got. It's an embarrassment. What? You didn't put the procedure. What are you talking about? I've got procedures. Yes, you have. So, I'll continue on. You have? Yeah, okay, maybe I shouldn't have done it. Oh no, you haven't. You haven't, have you? How did I not put the procedure on the consent form? How have I not done that? Yeah, so I'll be back in a minute. I've just got to put the procedure on the consent form. Right, sorry about that. That was a slight technical hitch in the paperwork for the next patient, which was completely no fault of my own. Well, I suppose technically it was my fault, but, you know, it's not my job to remember stuff like filling in the consent form properly. So, right, we just pretend that never happened. Yeah. Can you just get out of the shot, please? God's sake. Shall I do it the other way around? I'll do it the other way around. All right, I'll do it the other way around. Sorry, randoms in the background there. God, goodness me. Right, okay. Now, I've got to hold it up. It's holding it up better than down. There. Okay, so we've done the face. I've had a tummy tuck and I still have a bit of a reverse tummy tuck. Can this be done with a breast uplift? Crikey, can a reverse tummy tuck be done with a breast uplift? Geez, that's a good question. I don't think it can, you know. No, I don't think it can, because the scars are going to be the same. So I've got to say, a reverse tummy tuck is an unusual operation, and it's something you hardly ever have to do. The upper abdomen, usually liposuction would sort that out, and you wouldn't need to actually cut it out. But if you did need to do a reverse tummy tuck, the incision would be the same place where your breast lift's incisions would be. So I wouldn't combine it with a breast lift. No. So I'd separate them. It's a good question, that one. I've not heard before, but I think if you've got a upper abdominal tummy skin and fat, I would say it's probably better to have a. I should probably get the things out. Yeah, lipo fat. I've done that one. Right. Can you discuss the differences between ALCL, breast cancer, and breast implant illness? So, ALCL is a type of cancer that's associated with implants. We used to say there's no cancers associated with implants. There is one now. It's called ALCL. It's a cancer associated with implants. It seems to be due to the texturing of the implants, so it's much less likely in smooth implants. It's a cancer of the capsule, so it's not breast cancer. It's a cancer. It's actually lymphoma, and it's a cancer of the capsule around the implant. Breast cancer is a cancer of the breast tissue. So ALCL is not a breast cancer. So breast implants don't cause breast cancer, but breast implants can cause a lymphoma, which is a cancer of the capsule. Now, it's something we have to tell everybody now prior to surgery, because obviously it's a significant thing, but it's very rare and it's treatable. So it is about 95% of cases are cured by removing the capsule. So it's much more treatable than breast cancer, and it's much more rare than breast cancer, but still it's there and it's something to be aware of. But don't think that it's breast cancer, because breast cancer is a very nasty disease, and it can and is a lot more difficult to treat than ALCL. Oh, we got a question here. Sonia, I can see your question and I will answer it in a minute. Hopefully I can still see it. So yeah, breast cancer. Breast ALCL is a cancer associated with implants, and it is let's have some fireworks. And it is seems to be associated with the texturing of the implants, and it is not breast cancer. Breast cancer is so your risk of breast cancer, whether or not you have implants, your risk of breast cancer is the same, whether or not you have implants. And then you've got breast implant illness. So breast implant illness is different. Breast implant illness is a feeling, usually non-specific symptoms, malaise, generally feeling unwell. And again, it seems to be associated with implants. Now, the problem with breast implant illness, it's not a medical thing. We haven't really found a link for breast implants causing these non-specific symptoms. So it's hard to know how to advise people about it. Now, what I do say is it's something I don't really see. There are a lot of breast implants and I don't really see it. Having said that, if you go on the internet, if you go on the website, there's a lot of people, not the website, on the web, I suppose, yeah. There's a lot of people who report to have it, and a lot of people who say that when the implants are removed they feel better. So it's always difficult to know how to advise people about this when they ask questions about it, because it's hard to say for sure that these symptoms will get better if you remove the implants, because we don't know for sure that implants cause these problems. But there are certainly a lot of people out there who say they've got problems, usually non-specific malaise, tiredness, connective tissue diseases, generally feeling unwell. And then when they have the implants removed, they feel a lot better. So that's breast implant illness. That's not a cancer at all. So it's breast implant illness, breast cancer, and ALCL. They're all three separate things. We've got a question here, which is from Sonia. Can you have liposuction on the front and back of thighs? Thank you. Difficult to have it. Well, yes, you can have liposuction anywhere, is the answer. Can you have it on the front and the back of the thighs? Yes, you can. Usually the places where liposuction really works well on the thighs is the lateral thighs, the outside of the thigh. It might be a little bit difficult to get to the front and the back of the thighs, but you can always sort of bend the hip and bend the knee and lift the leg up. But you can have it on the back of the front of the thighs, but usually the lateral aspect of the thigh is the best area that responds to liposuction, but you can certainly have it in those areas. Yes, you can, Sonia. Is a possibility. But if you've got a very full thigh, maybe in those circumstances weight loss would be better. It's hard to sort of contour, unless it is just locally your thighs that are out of proportion with your body, but often weight loss would be a better thing to do than try and do sort of liposuction to contour globally the whole thigh. That might be difficult to globally contour the whole of the thigh. It's usually reserved for pockets of fat that don't respond to weight loss. There's also a question here from someone with a scar on the cheek, and asking about, will it be better I've lost it. It'd be better to, will it look better, I think, with a facelift? They were actually asking for the picture now. But basically the scar's sort of here, and I think that it will be a bit stretched, the scar with a facelift, and it may be pulled back. Well, it will be pulled back. The scar will be pulled back further on your cheek, but it'll still be there. And it won't actually remove with a facelift. It will just be moved further back on your cheek, which might be feel a bit odd. Oh my God, my scar used to be there. But I'm not sure if it was significantly improved with a facelift. To be honest with you, it looked pretty good to me. It was hard to see in the photos. The scar looked pretty good already. So I hope that's been helpful. I'm sorry about the poor connection. I'm sorry about the interruption halfway through with a tragic consent form issue. I accept there's been a bit shambolic, and it's not the usual high standard that I'm used to providing. But I will try. I'm not going to do it like this again, I'll tell you, that's for sure. I'll try and do it properly next time. So yeah, next time I'll probably be on time, 7 o'clock next Tuesday. So I will see you there. Oh God, we've got comments, sorry. Didn't see the comments. Hi, Olivia's here. Good to see you too. And I'm going to check myself out of here, and I'm going to do some surgery now. So have a good afternoon, everyone, and I'll see you later.